Hi, this is David Baumgartner with Counseling Theories, CP 612-70, Fall 2018, and I will be presenting Feminist Theory. Alright, where was it created? When did it come about? And what was going on in the world? This question you'll find is slightly difficult to answer. Feminist theory was not founded by one individual, but by several. It was founded through the collected efforts of a few women who shared similar goals. Feminist theory was founded during the women's movement in the 1960s during the second wave of feminism. In short, feminist theory was created in response to the grassroots movement. A few quotes that I found by Jean Baker Miller and then again by Laura S. Brown. Jean's quotes are, "They, women, can use their abilities to support each other, even as they develop more effective and appropriate ways of dealing with power. Women do not need to diminish other women. They need the power to advance their own development, but they do not need the power to limit the development of others. And then conflict is inevitable, the source of all growth, and an absolute necessity if one is to be alive." And then Laura S. Brown was quoted saying, "I think the challenges are to keep renewing our understanding of what feminism is, to keep expanding it so that we understand oppression and empowerment in new ways, that we don't keep on having the same definition of feminism as we did 30 years ago." Significant contributors. In picture order, we have Jean Baker Miller, Laura S. Brown, Olivia M. Espin, and Carolyn Zerby Inns. I say picture order because presentation order, it's a little different. First we have Jean Baker Miller. She was born in 1928. She passed away in 2006. She was the clinical professor of psychiatry at Boston University. She was the director of the John Baker Miller Training Institute. She helped to develop RCT, or Relational Cultural Theory. She continued to make further contributions to apply RCT to social action, workplace change, and diversity. She also made further contributions to applied RCT to the multicultural aspect of feminist theory. And next we have Carolyn Zerby Inns. She is currently Professor Emerita at Cornell College in Mount Vernon, Iowa. She has her PhD in Counseling Psychology from University of California. And she works implementing feminist theory in various cultures worldwide. Specifically with the Japanese culture. Olivia M. Espin. She's the first Latina to earn the award for distinguished professional contributions from the American Psychological Association. Espin produced publications that challenged LGBTQ issues. She also helped to establish the framework for other Latina psychologists to follow in her lead. And then beginning January 1st of next year, the National Latina Psychological Association will be changing its name to the Latinx Psychological Association in honor of her efforts, which I thought was pretty cool. Next we have Laura S. Brown. Denial of perpetration is simply not evidence that none has occurred, because even when there is physical evidence of abuse, sexual abusers of children may continue to deny that they did anything. The tactics of the false memory movement have shown remarkable parallel to those of sexual abusers who attempt to silence their victims, and I wonder why this is. Dr. Brown was a founding member of the Feminist Therapy Institute. She's the former president of APA Divisions 35, Society for the Psychology of Women, Division 44, Society for the Psychological Study of Lesbian, Gay, and Bisexual Issues, and former president of Division 56, which is Trauma Psychology. What I thought was interesting was that she was the on-site psychologist for Survivor, the Australian Outback. I believe that was the second season that had ever come out. And I would like to give a shout out to an unofficial sponsor of feminist theory, Mr. Alfred Adler. Was the only early theorist to support feminism, so much so that he incorporated social equality into Adlerian theory. Adler also advocated for women's rights, equal pay, equal rights, and advocated against the bias in language. Social action advocacy is a concept that is heavily encouraged in feminist theory, and we can thank Adler for paving the way for us. What need did it fill? During the time that the feminist theory was developed, there was a rising need for women's voices to be heard, with only Alfred Adler, many decades prior, supporting feminism and incorporating that into Adlerian theory. There were no other therapies that focused on women's experiences and needs from the perspective of the female client. A woman's development was often judged from a male's perspective. To quote our text, all these approaches provide a systemic perspective based on understanding the social context of clients' lives and are aimed toward affecting social change as well as individual change. So in short, feminist therapy examines the client not only holistically, but in their entire environment, including social, political, cultural aspects, as well as the relationships that are formed between those aspects. Until this point, most therapeutic interventions focused on intraphysic perspectives, especially for women in counseling. However, this push for a change in understanding and perspective was not strictly for girls and women, but also took on an egalitarian point of view in which this therapy can be applied to both boys and men as well. Egalitarian point of view is it's equality. It's true equality. Feminist counselors also educate clients about social action and advocacy. It also filled the need for empowerment among women and their supporters, as well as other oppressed or marginalized peoples, which would later include boys and men. It provided a new perspective in challenging the traditional ways therapy was utilized, such as with individual therapy, and took on a more outward perspective. Individual therapy takes on a more internal perspective. It filled a need in educating the client about sources of power within their own lives and assisting them in becoming their own active change agents. Okay, so why people hurt? People might be hurt due to feeling oppressed or marginalized. Oftentimes we hear or see, either in the news or as we're walking by, that an individual is being told negative things due to gender, sexual orientation, cultural characteristics, political beliefs, like what's going on currently in our country with the political beliefs and the political systems, and you're seeing family members hurting family members or neighbors hurting neighbors because of political beliefs. Also, people may feel frustrated and powerless in their environments, as with the previously mentioned. If you're told the same thing over and over, sometimes you begin to believe what's being told to you, and it starts to damage your self-esteem and self-efficacy. People want to reconnect with family or friends and do not understand how or why they're unable to. People may be aware of their own discriminatory or socialization processes, such as with sexism or racism or ageism, just to name a few. People may be confused about their gender role and and how it affects their relationships, both currently and in the future. People may hurt from lack of self-esteem and self-efficacy. Oftentimes we are our own worst judges when it comes to self-care and internalizing negativity. Oftentimes this is due to past events. However, feminist theory operates in the here and now and not in the then. And so really it focuses on our connections with other individuals and with ourselves to help bring about change. And as far as, why people hurt. And that brings us to how people change. The premise of this theory is that the defining constructs are described as gender fair, flexible, multicultural, interactionist, and lifespan orientated. I realized that that was a condensed description, and so I will elaborate a bit more regarding the constructs. Gender fair approaches can be best explained in that they're therapeutic goals. The counselor will help the client become aware of their gender role socialization, which is unique to each client and their background. Essentially, this theory approaches the socialization of men and women separately and not from the man's perspective, as we previously discussed. Gender fair approaches are reinforced through flexible multicultural perspective. In this perspective, concepts and strategies are applied equally, regardless of unique characteristics such as age, race, gender, sexual orientation, etc. Next, we'll discuss the interactionist and how the concepts that feminist theory use includes the client's contextual and environmental factors of both the internal and external behaviors. What I found interesting is that this theory also takes into account the lifelong process that we go through and how that influences our behavior over time. And that because of that, behavior isn't static, but dynamic. Behavior is ever shifting, ever changing. Change occurs by examining the external and contextual factors. Change occurs through empowerment, helping the client understand that they do have power over their own lives, and then determining how best the client wants to use that power for positive self-change. And that's through empowerment. Self-disclosure, counselor-client relationship is egalitarian. Self-disclosure is used to help maintain this balance, provide normalization through shared experiences, and to provide an example for the client to model. Power analysis. Change occurs through an examination of the power structure in society and within the client's cultural, gender role, and sexual orientation. Clients gain awareness in these areas and learn to appreciate themselves for who they are, while discovering areas in which they do have power. With bibliotherapy, change occurs through self-help. And this is through readings that the counselor can issue to the client. The readings can also supplement for the counseling sessions if used properly. With social identity analysis, change occurs through social identity analysis. The goal is for the client to become aware of internalized oppression within their values, thoughts, and behaviors, and then to adopt realistic internal thoughts. With social action and advocacy, counselors encourage their clients to become more active in those areas that are affecting them personally, and this can help increase their self-esteem and lessen the overall negative impact that the client is having due to power imbalance. With reframing and relabeling, change occurs through a process of reframing an internal problem through society's norms and how it is perceived by others. Through reframing, a client may be able to understand why they feel a certain way and how to shift the internal blame from themselves to those outside contextual factors. Also, change can occur through relabeling how a client is perceived. An example is a man who appears feminine would be relabeled as nurturing. And then finally, relational cultural therapy. Relational cultural therapy, or RCT, was created to help women and eventually men to enhance their connection and build networks, relationships, and become connected. In previous theories, women's relational characteristics were often viewed as weaknesses. With RCT, feminists promote these characteristics and help the client turn them into strengths. In order to accomplish this, empathy and authenticity are critical for the counselor to display with the client. Some of the qualities that are emphasized are authenticity and the contributions to the flow of the relationship, such as encouraging growth-fostering relationships. This is primarily due to self-identity being central in the contextual development of relationships. The idea that people desire and move through life creating relationships and that people are influenced by the same relationships, or inclusion, is a recurring theme throughout feminist theory. For instance, number 1 focuses on rebuilding, maintaining, and enhancing relationships and connectedness, and then promotes the idea that people desire and move through life creating relationships and that people are influenced by these relationships. Empathetic and authenticity are critical for the counselor to display and encourages growth-fostering relationships. These 4 fundamentals make up the basis that is relational cultural theory. Next are the 6 principles of feminist therapy. Number 1, the personal is political and critical conscious. A client's personal problems originate in political and social context. This also happens to be the most important tenet in feminist therapy. Number 2, commitment to social change. Counselors aim to change not only their clients, but to encourage social action with their clients. Number 3, voices of girls, women, and the oppressed are honored and valued. Through honoring these voices, counselors acknowledge them as invaluable and that the profound change can occur through society through and from these voices. Self-advocacy. Number 4, the counseling relationship is egalitarian. Feminine counselors strive to create and maintain a balanced relationship with the client. This is done by shifting the power from the counselors to the client. A lot of times there's, the base assumption that the counselor is the know-it-all. Practitioners of feminist therapy disregard that entirely and shift the power from themselves to the client. Number 4, the counseling relationship, number 5, a focus on strengths and a reformulated definition of psychological distress. In short, feminist counselors dislike labeling using the DSM-5. Due to this, feminists reframe client symptoms as survival strategies and their pathology as coping skills. And number 6, all types of oppression are recognized along with the connections among them. Feminist counselors understand that their clients are affected by their social and political inequalities and that this has a negative effect on them. Not only with the clients, but this is relatable to all people and is not bound by gender or other characteristics. Although this is feminist theory, it also works for both boys and men as well. It's not strictly for women or marginalized individuals. It can help a wide range of individuals, which I think is fantastic. To go over some of our key concepts and keywords, relation cultural theory, egalitarian relationship, gender fair approach, flexible multicultural perspective, interactionist, lifespan perspective, empowerment, self-disclosure, gender role analysis, power analysis, bibliotherapy, assertiveness training, reframing and relabeling, and social action, just to name a few. And then in the news, the 1960s edition. So during the time that the feminist theory was created, this is what was going on. This was the source and motivation for a lot of what was going on, and there seemed to be recurring themes during that specific period. We had the civil rights movements, both in our country and throughout the world, the women's movement, the Vietnam protest, the rise of Black Power, Stonewall riots in New York, I think were fairly important as well. We had Martin Luther King Jr.'s assassination, Bobby Kennedy's assassination, Woodstock, and then the founding of Domino's Pizza. I felt that was important to mention. One Fish, Two Fish, Red Fish, Blue Fish was published. The first contraceptive pill was approved by the FDA. And I think that may have been the initial spark behind all of this, because of the inequality that was present with that. We also have the Apollo program, the Bay of Pigs invasion, and the Gateway Arc in St. Louis was constructed during the 1960s. And reflection questions. What contributed to the creation and founding of feminist theory? How did national or world events begin to shape this theory? And what are some areas in your life that you feel inferior to another? That you don't have to answer this if you don't want to. It's 100% a reflection question. It's for your own purposes. But what I think is interesting is with this theory, it examines the relationships that we have with one another, and then the fluidity of the power dynamic that's there. And if we feel that one person has more power than we do, oftentimes that's where that inferiority comes from, is that power imbalance. And this theory really helps clients to sit down and examine those external relationships they have with others to help them discover, why it is that they feel inferior, whether they're a woman or a child or a minority or an individual that's been marginalized, or even a man who has androgynous features or characteristics, such as, they're nurturing or they stay home with the kids. So I think it's really interesting how this theory approaches therapy and counseling with clients. But, it's fantastic as far as the other theories go too as well. So, and finally, we get into references. So these are the sources that I used for all of this. Mostly was, heavy textbook. But then when I was putting this PowerPoint presentation together, I wasn't satisfied with what the textbook had to offer as far as information regarding the ladies that founded the theory. I was actually disappointed with the information that was provided in the textbooks regarding them, so I decided to seek additional information regarding them. And then, the history websites, because a lot of stuff happened in the 1960s, and a lot of it was civil rights movements and enforced inequality. But that's feminist theory in a nutshell. Comments or concerns, please post them below. Thank you.